Sickle cell disease is an inherited blood disorder that causes sickle-shaped red blood cells that can stick together, blocking blood flow and oxygen from reaching all the parts of the body. People with this disease can experience serious pain, also known as pain crisis, anemia and infection, and other serious health problems that may require treatment by the healthcare provider. Children and adults with the sickle cell disease often require care in the emergency department of the hospital or the clinic for the treatment when health problems such as pain crisis cannot be managed at home. Sickle cell disease affects millions of people worldwide, and in Uganda, over 20,000 children are born with the sickle cell disease every year. Church of Uganda Family TV engaged Dr. Sickle Barnabas, a sickle cell disease activist.
First of all, sickle cell disease is a genetic hemoglobin disorder in which the red blood cells that transport oxygen in the body change shape from their dominant smooth shape to a crescent or mono shape, which we call a sickle. What causes sickle cell? You see, in the hemoglobin, there are two different chains. We have the beta chains and the alpha chains. So on the beta chain, in the 60th position, when valine is substituted for glutamic acid, those amino acids, this forms the cell, which is the sickle cell, the red blood cell to be sickle. That's what causes sickle cell.
People living with the sickle cell disease seek care in the emergency department, an advantage of the 3 times a year from their late teen or their late 50s. Studies have shown that patients with the sickle cell disease frequently have difficulties getting proper treatment when they arrive in the emergency department.
But still, 80% of these children don't celebrate their 50th birthday. You see, many of them die before the age of 5. This calls for an alarm, and that's why we all need to synergize and fight against this phenomenon.
The treatment of the sickle cell anemia may not be easily available, so Dr. Sickle emphasizes prevention through the screening of the couples before the produce of the children.
The routine treatment, yes, it's preventable, as I've told you, that if you do premarital screening, we can know who is a carrier, who is not, and you make decisions having known what your status is. But we have different remedies of treatment. Treatment goes on which symptoms is this person suffering. You see, people having sickle cell, they're having issues with their health. One, they're having anemia.
He, however, advises that the best ways to live with the sickle cell disease is to find good medical care, getting regular checkups, prevent infections, and learning healthy habits. Dr. Sickle appeals to the Ministry of Health to do more sensitizations about the disease, since many people are still ignorant about it, while others believe myths about the disease.
You see, ignorance in the communities is too much about this phenomenon, and the ministry has taken less efforts to make aware of the various complications and how we can combat the spread of this phenomenon. But again, my much emphasis where the ministry is not doing well is in the provision of hydroxyurea. As I told you, hydroxyurea is too expensive. Each tablet costs around 1,200, and every child of sickle cell might need at least one a day. And look, in these impoverished communities of ours, someone cannot afford food and affords this hydroxyurea. So it's hereupon that we request the ministry to look through, as it's providing ARVs